Community mental health is one of the most important services that a community can have at its disposal. Lakes Region Mental Health Center is happy to call Plymouth and Laconia its home. Our building here in downtown Laconia was a 2-year project. And then in Plymouth, we recently purchased a building and renovated it right near the hospital and the high school and the middle school so that we can be accessible to everyone. We really strive to keep up with what's going on in our community, to respond to the anxiety, to the depression, to the things that life is dealing people right now. That's defined individually by everyone and is supported by our team of nurses, doctors, therapists, community-based workers, and specialized care. Mental health is also something that is stigmatized by the public, and we work really hard to do education and advocacy so that everyone can have a better understanding of what mental health is and why it's so important, and why it's actually part of having good health in general. Lakes Region Mental Health Center is an inclusive organization in that we don't turn anyone away, that we understand the importance of acceptance and diversity in our communities, and that we give about $500,000 in charity care. Our services range from multidisciplinary teams giving treatment to people who need short-term counseling, some medication therapy sometimes, some help with getting a job, some help with staying in shape and doing wellness activities with a specialized trained peer support person.
So one of the important things for us to be able to talk about is how we can increase the community's awareness of the availability of our mobile crisis response team. The state implemented this just shy of a year ago, and it's really important in terms of streamlining people's abilities to access services for mental health issues in the community. So that could be where the individual lives, it can be schools, it can be at a police department, etc. And it does enable a phone call to an access point where you will get screened by a mental health clinician, and if it is determined that you need on-site services, then they will dispatch a mobile response crisis team to you to provide an in-service evaluation. It is a significant change in the system, and the ability for patients to access this resource is really increased with the implementation of this recent project. So we really want to make sure that word gets out and people have an understanding of the value of this service and how they're able to get those mental health needs met immediately by calling that number.
We do a lot to make sure that our patients have primary care doctors, that they see specialty care physicians and nurse practitioners when they need it, so that they can live the fullest lives and achieve recovery in their own lives. Our biggest challenges in community mental health these days is really our workforce. Since the pandemic, we have seen an increase in people leaving the field and less people coming into the field. We understand that our staff is our most valued asset, and we hope that we will grow our business as the needs of the community grow.
I'm Dawn LaCroix. I've been with the agency for almost 39 years.
My name is Roger, and I've been working here for almost 15 years now, and I work in maintenance part-time.
So Roger, we've worked together for a long time, haven't we?
Yes, we have.
Yes, and you came to the agency initially as a patient, right?
Yes, started out as a patient and got employment.
Yep. It's been a long time, hasn't it?
Yeah.
What is, how's it been being here as a patient?
It was scary and nervous at first, but after a while I transitioned into being a patient here.
Yeah.
And more comfortable with now than I've ever been.
Working here and having an opportunity to work with individuals like you and watch people in their mental health recovery has really inspired me. And there isn't any place else would I like to work. I just like working here. Made a lot of friends with patients and staff that have become lifelong friends. So why did you stay here as a patient?
As a patient?
Yeah.
Because I like the way that I'm treated here.
So one of the things we're challenged with is to inspire young people today to go into this field and to understand that the work is not only rewarding and personally satisfying, but it makes a huge difference to everyone. and you never know whose life you might be able to touch.
One of our core values here is the integration of mental health and physical well-being. We firmly believe that mental health is inseparable from overall well-being, and our nursing services do play a crucial role in that. Our nursing staff works hand in hand with our mental health providers to ensure that our clients receive comprehensive care. From monitoring medication regimens to addressing physical health concerns, we are committed to promoting wellness in all aspects of our clients' lives. We work closely with Genoa Pharmacy to ensure our patients have the medications they need and can access them easily.
The other thing that I think is really important to recognize is how we're working on increasing our partnerships in the community.
I would say that as the executive director of a recovery community organization, with certainty, our collaboration with Lakes Region Mental Health Center is essential to achieving our mission of working with adults with substance use disorder. Over 20 million Americans identify as having a substance use disorder, but only 10% of Americans actually get the treatment services that they need. Navigating recovery, a lot of the people that we work with have a co-occurring mental health disorder along with their substance use disorder. Lakes Region Community Mental Health and Navigating collaboration, we have a lot of those shared clients, and that results in a reciprocity of the services that we can provide to them. Substance use disorder, it's important to understand, is a chronic relapsing brain disease, and recovery truly requires a village, a large community of people, and meaningful partnerships with like-minded people who are committed to joining the team and focusing all of our efforts on helping these individuals.
We have a relationship with Good Natured, where we have a little mental health library that provides free resources to those in the community who might be seeking a little help. It's sort of a lower stakes environment from seeking help directly right here at the center. We're normalizing our presence in the community, and by extension, that normalizes that it's okay to ask for help, that people can walk into the center and ask for help, and that is a normal, everyday occurrence. As a private, nonprofit community mental health center, we're relying on the financial support of the 24 cities and towns that we serve, as well as support provided by Belknap and Grafton counties. Not only that, but we're relying on the support of our donors. In fact, if you look around the center, you'll notice that donors provided funding for much of this center back in 2018.
Children spend a lot of time in schools, and so we collaborate with multiple schools in our catchment area in order to provide those on-site clinical services. So that not only increases access to care for those children and families, but it also allows us to enhance our collaboration and working relationships with the school personnel to support that student in being successful in their classroom and reduce any time that they have outside of the classroom that may have an adverse impact on their educational needs. We've also noticed that there's an increased demand for this service and have been recently contacted by 3 new school districts, and so we have also accommodated those school districts with being able to provide on-site clinicians to help, again, to support that collaboration, enhance patient care, and increase access to services and remove any barriers that may exist for our families in terms of getting their children to services here at our agencies. In addition to that, we're able to provide consultation for schools on any student that they may have that they're concerned about that is not a patient of Lakes Region Mental Health Center. So that also provides some additional wraparound services for the community, the students, the families, as well as various school personnel.
I think that collaboration and partnership is really the cornerstone in how we support young people and their families regionally and statewide, and I'm happy to be part of that boots on the ground that supports young people every day. But here in this region, you know, Lakes Region Mental Health Center really is the hub for that service and support, and so that has enhanced our ability to address needs as well. So in addition to this wonderful partnership and collaboration, you know, we've been able to leverage professionals here to come and talk about services and supports that are available in our community. understanding what the referral process should look like. You know, with the onset of New Hampshire Rapid Response Access Point, which has expanded care statewide, we were able to leverage professionals here to come in and talk to our professional staff about, you know, when do we make those calls, how do we make those referrals, and how do we ensure learners and families have what they need during times of risk. The partnership has been really beneficial for both our learners and families in the Guilford School District. It's provided us an opportunity to expand our capacity to address our learners' mental health needs and also remove barriers in accessing care, sometimes transportation or jobs.
Our goal is to help people recover from their illness and lead full lives.